So in this section, we're going to cover dyslexia, and most people think of dyslexia as a spelling issue. So this idea of dog as my co-pilot instead of God as my co-pilot. And so people think of dyslexia as a word flipping. So you tend to do saw and was, or God and dog, and so it's a spelling problem. But that's not quite the issue with dyslexia. So there are two ways to understand dyslexia. So it's orthographic or phonemic. So that's learning to read and reading as well. So the dual root model explains all of reading. And so let's think about dyslexia. So it's an unexpected difficulty in reading, not in spelling, but spelling is tied to reading, so we're kind of stuck with both problems. It affects 5 to 18% of the population, so a good chunk of people have issues with reading. Equally affects children and adults, also equally affects men and women. So it's not a children problem. Adults can have dyslexia as well, and so you'll see people get accommodations for it in college because it doesn't really go away. You can learn tricks to help, but it's not like a curable like the common cold where you can get rid of it. So people with dyslexia, IQ, motivation, school, all can be in the normal range. So you can have dyslexia across the whole spectrum. But one of the issues with learning disability is that it often gets tied to dyslexia. So if you have a learning handicap, you can also tend to see dyslexia. So while it can equally affect everyone across the IQ range, it does seem to co-occur with other learning disorders more. Okay? And it's genetic screwballs. Okay, so if one sibling has dyslexia, there's a 40% chance that the other siblings will. And if a parent has dyslexia, pull out your Mendelian squares here, but there's a 23% to 65% chance one of the children will. So it is sort of genetic. So what are some signs? How can we see dyslexia? So in children, especially, teachers are trained to look for trouble playing a rhyming game. So what rhymes with cat? And you can't do it because dyslexia tends to be a phonemic problem. So if I can't break down the word cat to its component sounds, ka, and at, I can't rhyme. I can't go bat, hat, because I can't break down the word. Word confusion, so words that sound the same get confused in their meaning. Mispronunciations is a big one. And then hesitations finding words. So that's more of a social issue. So you don't want to seem stupid, so you're sort of hesitating because you know you have this problem with which mispronunciation is or which pronunciation is correct. So some theories. Why does this happen? Okay. So originally the theory was that it was a perceptual problem. I'll talk about why that's not true. The phonological deficit hypothesis, and then the dual root model again. So originally in the 1920s, Orton argued that dyslexia is a perceptual issue. So and this is where people see it in the output. You think this is the problem. So P, it was a confusion between P and B because they look the same, and P and D, saw and was, when you flip them. Here's the issue. P, B, and D all sound the same too. So not only do they look the same, they sound the same. So I don't know how we were confusing, we're thinking about perception without also talking about sound, because P and D really do sound the same. So they've tested this theory, and dyslexic people do not perform any different on visual perception tasks. So it's really not a perceptual problem. There's not a breakdown in the perceptual system. And so we're talking about Posner's task, which we talked about a million years ago, the cueing paradigm. And so what he did was he had, or it wasn't Posner, they used Posner's task, but they had people get letters all in the 4 quadrants of the screen, and they had the letters either physically match, so capital A and a capital A, they name match, so capital A and a little a, or they mismatched. So dyslexics were just as good as normal controls on a physical match and a mismatch, but the name match was an issue. So there's something about the capitalization of them that caused problems, but it wasn't a physical issue, which would be a suggestion that's a perceptual problem, so not a perceptual problem. The phonological deficit hypothesis is that dyslexia results from an inability to break down words into their component phonemes. So I can't rhyme, I can't pronounce, I have all these other issues because I can't break them down into their little pieces. So there's a deficit in phonemic awareness. I can get the whole word, but I can't get the sounds. And that's pretty true because we believe it's actually two different issues. So there is the lexical side, the orthographic side, where I am accessing the pronunciations of whole words at once. And that's usually used for exception words like have and well-learned words. And this is orthographics. So some people have a problem with this particular side. More people have a problem with this GPC root. So I have grapheme phoneme correspondence, that's the sound to spelling words rules, and I have trouble pronouncing new words and non-words. So this is all about phonemes. For surface dyslexia, there's a breakdown in that lexical root, and that's less common, about 16% of people. For phonological dyslexia, the breakdown in the grapheme phoneme correspondence or the sound to spelling rules, that is the more common form of dyslexia. Sometimes people have both, but phonological is generally the issue. So there's nothing wrong with the phonological deficit hypothesis, but there's also a problem with the surface lexical orthographic issue. So phonological deficit just doesn't quite explain everything, whereas the dual root model explains both. So what do? Well, with children, a highly structured set of instructions on code-based reading strategies, so learning words in context, and then speech therapy. So physical production patterns, so how do you make the sound, and then helping people learn how to break down words into sound. So lots of training, especially sound-based training, but also some code-based training. So that's the reading in context, understanding that this time it means read and this time it's read. So getting when the pronunciations aren't necessarily the general sound to spelling rules. What do you do with adults? Well, you give them extra time to read, and especially this one for the spell checkers and tape recorders, so recording a lecture and listening to it again, and tutors. So even adults need the extra time for help, so it can get better, but it isn't really a solvable problem. And dyslexia overall is sort of a pervasive issue that we really have to think about and help people work through because it affects so many things. So if you're thinking about language, especially in school, you know, you've got readings, you've got to watch videos, you've got to talk to your friends, you have to talk to your professor, you have to write emails. So we really have to think about how it affects a lot of daily life. So having the learning diagnostic clinic like we do on campus really helps, and having tutors and accommodations is a way to help us sort of combat the issues that people see when they have this dyslexia problem.